The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. Joining me this morning is my co-host, Vin Martello, our Director of Community Health Relations. Good morning, Vin.
Dr. Smith, how are you today?
Fine, thank you.
Dr. Smith, our listeners know that we speak to experts and professionals from a wide array of community organizations that work on various aspects of preventative health and wellness and sustainability. And today we have two very special guests, and why don't you introduce them for us?
Sure. Our guests are Dr. Melinda Clark. Dr. Clark is a board-certified pediatrician and an associate professor of pediatrics at Albany Medical College. Her areas of special interest include pediatric oral health, international adoption, quality improvement, and child abuse and neglect. She has served on several national committees, including the American Academy of Pediatrics section on oral health, and currently serves as the chief editor for both Smiles for Life, a national oral health curriculum, and Protecting All Children's Teeth, the American Academy of Pediatrics Pediatric Oral Health Training Program for Physicians. She also serves as the American Academy of Pediatrics New York Chapter 1 Treasurer and Chapter Oral Health Advocate. Also with us is Jamie Mowers. Jamie is currently employed by the New York State Association of County Health Officials. She is the Public Health Associate focusing on maternal child health and oral health and early intervention. Jamie has her master's in public health and her master's in social work. Her work includes assisting counties in rolling out public health detailing and in spreading the message on the importance of fluoride varnishing in preventing dental caries in children. Let's start with you, Dr. Clark. Could you tell us a little bit more on the issue of oral health and why it's important that we focus on it?
Certainly. So dental caries, tooth decay, continues to be the most common chronic disease of childhood, but it's nearly 100% preventable. Tooth decay prevalence is roughly 6 times that of asthma, and the burden of the disease is unfairly shouldered by children of lower socioeconomic status and minority children. These children often face substantial barriers in accessing dental care. Dental caries, tooth decay, it causes pain, sleeplessness, poor nutrition, can interfere with growth, causes problems with speech, school attendance, and can result in poor academic performance. We also know that tooth decay can result in infections of the head and the neck and sometimes causes death in young children in particular. We know that the rates of tooth decay are incredibly high on a national level and right here in New York State and in Ulster County. There was one study several years ago of children enrolled in Head Start, in early Head Start in New York. And that survey showed that 40% of children had tooth decay, and over 70% of those children had untreated, active tooth decay that wasn't getting any medical or dental treatment. New York State Prevention Agenda put out statistics several years ago of 3rd graders in New York State having untreated tooth decay. The rates in Ulster County were 34%, a full 10% higher than New York City rates of children. There also remains a limited number of pediatric dentists and general dentists who are comfortable with these very small children, those highest risk for the disease, least likely able to access the care that they need.
Well, it certainly makes sense then that pediatricians and other primary care doctors start looking at the oral health of their patients and addressing issues when they see that child developing dental caries?
I certainly think so. One of it is how common the disease is. That's one of the issues, is how common the disease is. And the second issue is how well other health providers that are not dentists or dental health professionals are trained to look at the teeth and the mouth. So in order to recognize a problem, I have to know I should be looking, know what I'm looking at, and have a resource to get the child the care that they need. Prior to 2015, it was estimated that less than 5% of pediatric primary care practices in New York State were providing any kind of oral health preventive services. Less than 5%. That's one of the reasons why we began this particular prevention agenda, to try to activate, incentivize, and help pediatric practices to understand how they can be involved in the fight against oral disease for children. In 2014, the United States Preventive Services Task Force formally recommended that primary care providers apply fluoride varnish to the teeth of all infants and children, starting at tooth eruption and through the age of 5. So back in 2009, New York State Medicaid program approved fluoride varnish and oral health preventative services for young children from tooth eruption through the age of 7. But in 2014, this expanded to cover all children. So not just poor children, not just children of low socioeconomic status, but all children could be appropriately cared for in the primary care medical home for oral health prevention services. The USPSTF gave that recommendation a B grade, meaning that practices must offer or recommend this service, and it must be done with no cost sharing to the patient. The American Academy of Pediatrics then subsequently published their fluoride use in caries prevention in the primary care setting guidelines in September of 2014. And the AAP formally recommended that primary care providers apply fluoride varnish and do risk assessment 2 to 4 times per year for children ages 5 and under. So we're talking about very young children who are now able in their primary care medical home to receive oral health prevented services and appropriately referral to establish a dental home, and that the providers will receive appropriate reimbursement for those services.
Yeah, once the United States Preventive Services Task Force makes an announcement like that, and for folks who may not be familiar with that's the premier agency in this country which comes together periodically to evaluate preventive health measures. And they look at all aspects of that, including whatever scientific evidence there exists to support their findings. And when they come through with a recommendation like that, insurance carriers are supposed to cover that particular service, because it has been found by scientific evidence to substantially decrease the numbers of cases of tooth decay that are being seen. So it's really considered a very much an evidence-based kind of recommendation, and it reaches the highest level of scientific circles in this country.
And Dr. Can you explain to us a little bit about what fluoride varnishing is, what the process is, how long it takes, what parents can expect when they bring their child in to get it?
Yes, that's an excellent question. So fluoride varnish is essentially a lacquer that is painted on the surfaces of the teeth of children, and it sets on contact with saliva. So in the old days, there were the gels that we had to put in trays, and you had to hold them in your teeth at the dentist office. Those were very impractical, required a child to cooperate, to have the maturity to be able to hold it there, to sustain contact with the fluoride. But fluoride varnish takes about 30 seconds. We simply lay the child down safely. We wipe the teeth with a gauze pad. We lay the child down, usually in the lap of the provider. We wipe the saliva away with a gauze pad, and we literally quickly paint the teeth with this fluoride varnish, which immediately holds, sets on contact, and then provides the teeth many days worth of extended fluoride protection. So instead of getting swallowed, it gets incorporated into the surface of the tooth and turns the enamel to a harder form of enamel that's more resistant to tooth decay. This can be done according to the USPSTF and the American Academy of Pediatric guidelines 2 to 4 times per year for children. Since we see very young children so frequently in the pediatric office, we merely add this on to all of their other safety and health prevention services that they receive when they go to the doctor. Your doctor talks about riding in a car seat, eating healthy meals. We talk about wearing your seatbelt. We talk about sleeping and development. We also give immunizations, do blood draws, and paint the teeth with fluoride varnish. So it's become a routine standard of care. It adds about 30 seconds of time onto the visit and allows that child to have protection for several days as opposed to several minutes that you might get with protection of brushing the teeth with a fluoride toothpaste.
And interesting. Now, next I'm going to ask the question that my 10-year-old daughter would ask. Does it taste good too?
It does. So these are products made by dental companies in the business of selling the product. So many of these products, they come in 2 separate doses for very small teeth and doses for older children with more teeth in the mouth. Those are all good flavors. The flavors for young children that we buy in our office are bubblegum or strawberries and cream.
Those will work every time.
The procedure or the application is completely painless. Mm-hmm. Sometimes the children fuss because we hold them down, but I'm a pediatrician. I'm kind of immune to crying at this point in my career. And I think it's important to recognize that if the child's fussing, then we can actually see the teeth and the whole procedure goes by faster. So how we do it in our office is we go in, we do our usual history, our physical examination, we step out, get the supplies that we might need, varnish the teeth, and we do so before we do anything else that might cause pain, such as a blood draw.
And how often does this procedure have to be done to keep the child protected?
So the trade-off is doing a procedure often enough to get the benefits and not doing it more often. The trade-off is always doing a procedure often enough to see benefit, but not so often that you have excessive cost or any potential for risk. The USPSTF recommends this procedure, or fluoride varnish application. The USPSTF recommends fluoride varnish application 2 to 4 times per year for children. So essentially once every 3 months between tooth eruption through the age of 5.
Great. And, we're going to take a short break right now. We'll be back to Dr. Clark to get more information on this really great preventative measure, and also to talk with Jamie Mowers about the concept of public health detailing, which is working with providers to really get information out about best practices and to help them really stay right at the cutting edge of preventative care for their patients. We'll be back after this.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Our special guests today are Dr. Melinda Clark, a pediatrician who is a leading advocate for oral health training programs for physicians, and Jamie Mowers, who is a health associate with NYSHO, the New York State Association of County Health Officials, also promoting public health detailing. Dr. Clark, can you tell us a little bit more about why focus on pediatricians at this point in your advocacy for oral health?
Yes. So we're focusing on primary care providers that take care of young children or have access to young children. As I mentioned earlier, there are a limited number of pediatric dentists and general dentists who are comfortable with young children, and even less of them who accept Medicaid as dental coverage. So despite many children having Medicaid in New York State as a payment source, so they're eligible for dental care, still over 90% of children under the age of 3 do not access dental care. So they have dental coverage, but they don't access dental care. Most children under the age of 3 do not see a dentist, but almost all of them see a primary medical provider, as many as 13 times by the age of 3. So to this end, that's why we began the program for Medicaid coverage for oral health preventative services in New York State in 2009, and then expanded it for coverage for all children in 2014. And pediatricians have several things that they can do to promote good oral health in their offices. The first is they can regularly examine the teeth and mouth. They can look for signs of plaque and early decay. They can speak with the family about the importance of early oral hygiene, brushing and flossing of the teeth. We are already talking about healthy nutrition, especially in this era of overweight and obesity. And many of the messages around overweight and obesity prevention are healthy teeth messages. So it's giving that same message about keeping your whole body healthy. It's giving that same message about keeping your whole body healthy will also keep your teeth healthy. And for some families, maybe they are very interested in preventing overweight and obesity, or preventing high blood pressure or diabetes. And for maybe some families, the lever for behavior change is prevention of tooth decay. That might resonate with them and be very important to them, help them to make some behavior changes that will keep the child healthier.
Well, certainly the statistics in the United States certainly give credence to this. It is estimated that 1 out of 4 children between the ages of 2 and 5 have tooth decay. And 1 in 2 older children, 2 out of 3 adolescents have tooth decay. So certainly there is evidence that we need to do more to promote oral health education and treatment among our pediatricians and primary care providers who are seeing children of very young age. And maybe Jamie can tell us a little bit more about how do we approach doctors in giving them the public health education that we feel is necessary to help change these numbers for the better.
So currently, NYSACHO, the New York State Association of County Health Officials, is working on a project with Dr. Clark in partnership with the New York State Department of Health to do outreach from the local health department level. So we've had multiple webinars, a lot of different technical assistance phone calls to help these staff people at the local health departments to not only learn the content of what they need to be discussing when they go to these educational visits to provider offices. So at this point, they've learned all about fluoride varnish, all the statistics that we're talking about today, plus much, much more. All the new guidances that have come out. And we're talking to them about what to take with them on these short, unscheduled 5 to 10 minute visits to pediatrician offices, and how to talk to physicians about this new guidance that's come out, because this is something it's a new role for the local health department, but it's a new role for pediatricians too, and to really kind of levy that alliance between the local health department and to make them a support for these pediatricians as they try to take on this new role. Public health detailing is based on a pharmaceutical model. It is an evidence-based practice of making these unscheduled visits to share information.
And in this case, I think it's not really marketing a product, which is what a pharmacy rep is doing, but really providing evidence-based, objective information that is of real value to the physician that wants to really be on the cutting edge of best practices. So I would imagine it's well received, pretty much.
The feedback that we've gotten on our fluoride varnishing project is that it is very well received. Pediatricians are on board, and then they have somebody to reach out to ask questions as they come up. Mm-hmm. And then we have our own little support group to help answer those questions, because if it comes up in one county, it's bound to come up in another county. But for the physicians, the local health department staff is that first line of communication that they can go back to with questions.
And is it integrated, already integrated into their billing and payment systems, so that it's pretty easy to just make it happen for them?
For the fluoride varnishing,
yes,
it is something. There's the CPT code 99188, so it is billable through primary care. So this is a project that was already very well laid out. This is just one topic though, and with public health detailing, it's such a versatile tool. It really depends on your community. If you're not a pediatrician and you're a primary care physician in a community where maybe the heroin epidemic has really hit your community really hard. This is something that, using community data, the local health department could determine that, and they may be able to go out and help come up with different guidances from states like California or federal guidances that may have changed around prescriptions. So it's something that can really be tailored to any community and any different topic that's necessary to improve the population health in your community.
Is this pretty much, working in the health education realm of the health department, is this the type of information that's really written and written in such a way that it's for professionals, or can the average layperson or parents or whomever also access that information and so that they can be more well prepared when they go for their doctor's visits?
Part of the public health detailing framework that we're working within right now is using toolkits. So New York City has a very large public health detailing program. They have a lot of different toolkits that are available right on their public website. And in a lot of the toolkits, and the ones that we hope to help develop in different local health departments, include not only materials for the physicians to help them through new guidances or whatnot, but also things to give their patients that will help the patients understand whatever issue or health outcome you're trying to achieve.
I think that's really a critical component, right? Because improving one's health and preventing disease is really a partnership. And I've always found that in working with professionals, whether it's lawyers or accountants or doctors, whatever, as a layperson, you might not, you don't know what you don't know unless you educate yourself and ask the right questions. So sometimes if you're talking to a busy professional, such as a doctor, if you don't ask that question, maybe it gets overlooked here and there. And I think that this is a great way to help keep all parties informed so that it's a much more productive and effective visit and strategy.
Also, if listeners want to get more information on fluoride varnishing as a way to help their children avoid tooth decay, they can go onto the New York State Department of Health website, and there is additional information on the value of the fluoride varnishing, so parents can get added information about the safety, the value of doing it in terms of decay prevention, etc.
And Jamie and Dr. Clark, what other sites or sources would you recommend for folks out there that want more information on this subject and really want to educate themselves, or maybe even work with their doctors more effectively?
The American Academy of Pediatrics has a healthychildren.org website, which is directed toward families on a number of educational items, some of which are oral health related. So it does talk about oral hygiene. It talks about the importance of establishing a dental home, going to see a dentist at a young age. And if you go to the AAP website or you Google healthychildren.org, you can get to that website and find out the experts on children, their viewpoints on a number of items, which also includes oral health.
That's really terrific. Well, we're about winding down on the amount of time that we have today, and we'd like to thank you, Dr. Clark and Jamie Mowers, for making the trip down from Albany to share this critically important information with our listeners. We really work to educate people about preventative health and what role they have to play in it. And thank you so much for sharing your time.
Thank you very much.
Thank you.
Thank you.
Listen, you're listening to Healthy Ulster Radio. If you have any comments, questions, or would like more information about this topic or others, please send an email to healthyulsterradio@gmail.com. And in the meantime, have a great week. We will see you next week with more information that you can use to keep your family and community healthy and strong with Healthy Ulster Radio. Thank you. Bye-bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.